Hi, I'm Maria. This is my school trigger. So I'm over here setting up my console. For the sinus series, I will be doing the Caldwell, the Waters, the SMB, the lateral, and for the orbits, I will be doing the modified Waters, the right and left lateral, and for the mandible, I will be doing the PA axial and the axiolateral along with the axiolateral oblique. Okay, so I've detented my tube. Now I'm going to come lead my bucky because I will be asking the patient to put their face on it, so it needs to be clean. Don't want any pimples. Okay, throw that away. And I'm done. Go get my patient. Hi, Miss Spencer.
Hi.
Hi, can you tell me? My name is Maria.
Hi.
I'll be taking some x-rays with you today.
Okay.
Can you tell me your full name and date of birth?
Christy Benscoter, August 8th, 1989.
Oh, thank you. Thank you.
Yes.
And is there any chance that you may be pregnant?
No.
Okay. And what happened?
I fell. I was running up some stairs and I tripped and I fell on my face.
Oh, no.
And I hit right here, but it's been hurting over here, so.
Okay, so that area is
On
where
my,
you're having
yeah,
more pain.
on my right side, yeah.
Okay. Okay, let's walk this way.
Okay.
Let me put a shield on you before I get started.
Okay.
Don't need to radiate your whole body.
No.
Thank you. I appreciate that. Okay. So we're going to be doing a few positions. I'm going to put this shield on you too. Okay. Sorry about that. It's very heavy.
Nice and protected.
Okay, now that you're shielded, turn around and face the board, please.
Okay.
Okay, so I'm going to be getting the OML perpendicular to the IR. So place your nose and your forehead on the bucky there. Okay, make your nose touch. There you go. Whoa, are you okay?
Fine.
Okay. All right, so I have a 25-degree angle, cephalic angle. And I'm going to be exiting the campion. Right about. Okay. My technique would be 70 to 75 at like 8 mass. Okay, now I have my patient positioned for the axiolateral projection. So I have a 25-degree angle on my tube here. And it has to be a true lateral, so I obliqued her in order to get her face closer to the IR. So I'm making sure she's straight and the inner pupillary line is perpendicular to the IR. Look, my marker there, okay. I'm gonna shoot it. Center ray is at the gonian. So I'm gonna adjust her a little bit there. Okay, now for the body, I'm gonna oblique her head a little, 30 degrees, still entering at the gonian. I'm gonna shoot that, and then for the symphysis, I would rotate 45 degrees, and still at the symphysis, at the gonian. At 25-degree angle still. Okay, now this is the sinus series. Okay, and it's the Caldwell method. So I'm going to have my patient, I angled my bucky 15 degrees, which will place the OML perpendicular, and the tube is perpendicular too. So she has her nose and the forehead against the IR. Center ray exits the nasion. Yes. These images are being done to show the air fluid levels, and this is showing the frontal and anterior ethmoid sinuses. My technique would be 70 to 75 at like 8 mass. Okay, I have my patient in the Waters position. She has her neck extended. She places her chin on the IR. MSP is perpendicular. The OML forms an angle of 37 with the IR. And the mental meatal line is perpendicular. See, it's exiting the campion. The water shows the maxillary sinus. The lateral position shows all the sinuses. And I would be placing the interpupillary line perpendicular to the IR. And I move the patient so they're oblique, so the face is closer to the IR. For a true lateral, so the center ray is entering 1/2 to 1 inches the posterior to the outer campus. It's right there. My technique for the lateral would be 70 at like 6 because you need a little less technique. This is my SMB position, and this will be showing the ethmoidal and sphenoidal sinuses. Now I'll have my patient here put her head on the IR.
Oh, okay. Like this?
Yes. And I will be centering 3/4 of an inch above the EAM and MSP to the middle of the gonian. Okay, and I'll be placing the IOML parallel with the IR. Okay, good. What? Now we're moving on to the orbits, and I have put my cassette here because we are not using a grid. Technique would be 70 at like 10. Okay, so my patient is resting her chin on the IR, and the MSP is perpendicular. OML forms a 50-degree angle with the IR. Let's see, close your eyes, and it's exiting the orbits. This is to show if there's any foreign bodies in the orbits. Okay, now this is I'm going to be doing the right and left laterals of the orbits. So I'm centered at the outer campus. Okay, and that's the affected eye. So I'm on a true lateral that the interpupillary line is perpendicular. Okay, so now we're doing the left orbit. So I'm centered at the outer campus again. My patient moved, but here.
Sorry.
Okay, and I'm making sure the interpupillary line is perpendicular. Okay, which she is, and this is showing any foreign bodies, and the roofs of the orbits are superimposed. This is a PA axial projection of the mandible, showing the body and the rami. So here is the condyles and the gonian and the mental protuberance. This is an axiolateral oblique of the mandible. Here we have the ramus, the body, the angle, also called the gonian, the coronoid process, and see, this is the oblique to show the body is shown by a 30-degree angle towards the IR. The symphysis is shown at a 45-degree angle, and the ramus is shown at a true lateral. The region of the mandible that is parallel with the IR is the one. This is a PA projection of the frontal and anterior ethmoid sinuses. Here's the frontal sinuses, the maxillary sinuses, the sphenoidal sinuses, and the ethmoid sinuses. And you can see that the petrous ridges are in the lower third of the orbit. This is a parieto-acanthial projection of the maxillary sinuses. Waters method. These are the frontal sinuses, the ethmoidal sinuses. Here are the maxillary sinuses. And you see the petrous ridges are lying inferior to the maxillary sinuses. Orbits. This is the lateral projection of the sinuses, and you can see all 4 sinuses in this projection. Here's the frontal sinus. This is the ethmoid. This is the sphenoid, which is the most important for this projection because it's the one that's most posterior. And this is the sella turcica. This is the maxillary. And this is the superimposed rami. And you have to make sure that the orbital roofs are superimposed and the sella turcica is not rotated. This is the SMV projection showing the ethmoidal and sphenoidal sinuses. Here's the ethmoidal sinuses, there's the vomer, there's the sphenoidal sinuses, the maxillary sinuses are visible here too, and the mandibular condyles are anterior to the petrous ridges. And here's the foramen magnum. This is the modified Waters method for the orbits, and the 50-degree angle is placing the petrous ridges below the orbital shadows right there, and you can see there's a foreign body there, and you need to make sure that there's no rotation. And you can see the maxillary sinuses, the ethmoidal. This is a lateral projection of the orbits. You mainly want to have the orbital roofs superimposed and the interpupillary line perpendicular to the IR. And this is to show foreign body, if any.
Still here.